morning to all, respected principal and my dear colleagues. Today we are gathered here to celebrate National Pharmacist Education Day on 6th March, which is tributes to Professor Mahadev Lal Shroff. He is recognized as the father of pharmacy education in India. He certainly remains an idol to all pharmacists working in this, irrespective of their branches and diversity of duties. He played a great role for building pharmacy education in India. He also contributed to the development of other aspects of the pharmacy profession. Professor Shroff started the Masters of Pharmacy Education in 1940 at Banaras Hindu University. With his efforts, slowly, pharmacy education appeared unexpectedly in different places in India. This year, Pharmacy Council of India decided the theme for Pharmacy Innovation 2024 is Leveraging Synergism, which is Industry-Academia Partnership for Implementation of National Education Policy 2020. At this moment, I would like to draw your attention and request everyone to rise up in respect of our SNDT anthem.
संस्कृता श्री पराशक्ति स्वर हमारा है। संस्कृता श्री पराशक्ति स्वर हमारा है। विश्व है परिवार भारत घर हमारा है। विश्व है परिवार भारत घर हमारा है। हम सभी है दीन कहता कौन हम अबला है। सबल संस्कृति हमारी हम सभी सबला। ज्योति से जगमग हुआ अंतर हमारा है। विश्व है परिवार भारत घर हमारा है। स्वप्न खाकर सी हुआ साकार है इसमें। महर्षि करवे तपस्या सार है इसमें। हम दिशाएं और ये इनकर हमारा है। विश्व है परिवार भारत घर हमारा है। संस्कृता स्त्री पराशक्ति स्वर हमारा है। विश्व है परिवार भारत घर हमारा है। विश्व है परिवार भारत घर हमारा है।
Thanks to all. Now please take your seat. Now I would like to invite Pranavi to introduce our today's chief guest, Dr. Rohini Wagmare.
Good morning to one and all present here. Pharmacists don't just fill prescriptions, they fill hearts with hope. With this, happy National Pharmacy Education Day. A warm welcome to our guest, Dr. Rohini Wagmare ma'am, our principal sir, Mr. Dinesh sir, our professors and my dear friends. We all gather to celebrate a day dedicated to profession that silently works in background to our healthcare professions. Systems yet plays an impactful role in our lives. I take this opportunity to introduce our esteemed guest, Dr. Rohini Wagmare ma'am. Ma'am is currently working as assistant professor in Shulza College. Ma'am has completed her bachelor's in pharmacy from MGVS College of Pharmacy, Pune University in 2005. She completed her master's in pharmacy from Siyusha College of Pharmacy in 2008. She also completed her PhD from there. She has research specialization in pharmacognosy, phytopharmacology, and metabolic disorder. She has 18 years of experience in research. Her work includes hypolipidemic activity of Cyprus rotundus. Till now, she has submitted 12 presentations. She has worked on 8 publications. She has received 6 grants from ICMR, SNDT University, ACG Associated Capsule. She was awarded with Career Award for Young Teacher from AICTE for year 2014 to 2017. She also filed a patent on 29th November 2019. Ma'am, it's an honor to have you here. Thank you so much. I would like to request Principal Sir to facilitate our ma'am.
Thank you, Pranamvi, for well and brief introduction of Dr. Rohini ma'am. Our principal sir, Mr. Dinesh Girab, I welcome you. Now, I would like to request you to speak few words.
Good morning, everyone. Thank you so much. And I'd like to congratulate all of you on this National Pharmacy Education Day. We do celebrate such days, like I'm from electronics engineering background, so we celebrate Engineers Day. And likewise, every profession has got their days, and we celebrate these days so that we get an insight of our profession. The stalwarts always these days, if you have observed, are named after some or the other fatherly figure or the stalwarts in the particular area. And so Mahadeva Lal Shroff, so he is the one because of whom this day in his memory we celebrate. Sir Vishwesvaraya is the one engineer, in his memory we celebrate our Engineers Day. And just now the comparer mentioned that the theme for this year is industry interaction, right? Industry academia interaction. And considering the new national education policy, industry interaction has become very, very vital, because the education that we were imparting till now, and the education, you are still in the second year or first year? You are in the first year, right? First year students. So you will definitely go ahead with your degree, with your masters, with your PhD, probably some of you. So still there is a long way ahead. And you are going to be a part of this new national education policy. So it's very important for us teachers to first understand the difference, what it was, how the education was till now, and how it's going to change. And then we have to guide you people, make you understand how the things are changing. You all are pharmacy students. So we have recently gone through bad phase of pandemic. 2 years, everything was a standstill. And when such was the case, at that time, all the medical fraternity, including paramedical staff, they were at work. They were working day and night to ensure that the world is in safe hands, like world sells through these problems. And when we see our future, in future also we expect such unknown things happening to human lives. Day and day things are become very strange. As the technology is advancing, the things are also changing. And in such a scenario, no doubt the past knowledge is important, but at the same time we should be able to predict the future and take precautionary measures. So understanding what is happening there in the industry is equally important. Where the industry is heading, it's equally important. And that is why you have seen that the curriculum of all the streams, not only in the pharmacy, but all the streams have changed, has been changed drastically. And that change is done keeping in mind the needs of the future. So my only message to you today is keep yourself abreast with what is happening in the industry. The way the technology is changing, we engineers, we always say that the technology is changing at a very, very rapid pace. And so the research which is taking place in the industry is changing. So the equipment probably you will be using are changing with the change in the technology. So you should always be keeping in pace with the latest happening in the industry. Today there is a Maharozgar Mela wherein people have gone, your seniors probably will visit there for getting jobs. So when you are going to seek a job after your diploma, after your degree, or after your PG, or after your doctorate, at that time try to get into such companies where there is a cutting edge research taking place, where you would get to work on futuristic problems. Don't be content with working in the store, drugstore. No doubt we require manpower at that level as well, but as a future workforce coming out from SNDT Women's University, we would definitely want you to work in very, very advanced field of pharmaceutical sciences. So my again best wishes to all of you, and again thank you ma'am, Rohini ma'am, for accepting the invitation and gracing this occasion with her keynote address. Thank you so much.
Thank you, sir, for your kind words and inspiring. I would like to request ma'am to facilitate Mr. Dinesh, sir. Now, I would like to request Dr. Rohini Wagmare ma'am to enlighten the future pharmacist with the inspiring and precious words. Yes, it is.
Thank you, Doctor.
And this is for recording. This is for recording.
First, be easy. I can see the beautiful faces in beautiful saris, in happy mood. So we will enhance your mood. This is my promise for all of you. And this is not a kind of buzurgo ki salah kind of thing. This is a simple discussion. I am also in learning phase, and your tiny aspirant pharmacists are also in learning phase. So let's start with everything. When you got admitted in pharmaceutical education, everybody had a kind of face to you, that kind of question to you. You might have faced that thing. That abhi jaake kya karoge? Dukan chalaoge, a kind of thing. But whether that profession, dukan chalana, working behind the table as a pharmacist is simple thing? Is it a simple thing? Morning, good morning. Is it a simple thing? Yes, because when you're working over there, by position you got a great responsibility. Anybody is fan over here of Spider-Man? A very famous saying or a kind of sentence is there. Great power gives great responsibility. You are having power to dispense, you are having power to, or you are actually got the authority to handle the prescription. That means you got a great responsibility. And this responsibility I am just going to discuss with few cases which happened previously, and with this aspect, because I have got a theme from Ganesh sir, that is evolution. There are some keywords are there. Evolution in public health, from dispensing to comprehensive health services. So you are going to evolve. Everybody is aware of evolution. The evolution is going to happen, and from just simple mere dispensing, there is need of comprehensive health services. So what is dispensing? Once upon a time there was compounding. People used to prepare the creams, the pills, powders, and they used to do compounding and they used to pack it, and then dispensing used to happen. Nowadays, compounding usually happen in pharmaceutical company industry over there, and we go for dispensing. So in Indian scenario, what is there? We just handle the prescription. We read all those drugs. You are going to do this thing in your there is some thing is there, na? That you are going to work in the pharmacy store or in hospital pharmacy. You will have your internship over there. So you are going to do that with again great responsibility. And you are also learning how to handle prescription. What should be your own thoughts during handling prescription? Everything will be there. So once you get the prescription, people what they think, you are reading the thing and you are just dispensing, like kirana mal. Kiranachi list dili and we get that. It is not at all like that. We always go for drug interaction, drug herb interaction, many interaction you are supposed to see when you have the prescription. If it is not happening, the comprehensive health services, if it is not happening, what usually happen? 3 cases I am going to discuss with you all. As she told that I am mainly teaching pharmacognosy or phytochemistry, some of the cases are like that because it's in Indian mind setup. That is something which is very herbal, it is very safe and no side effect or adverse effects are there. It is not like that. You are going to learn pharmacognosy, that all the phytochemicals or all these drugs are very potent in nature and they do have the effect on your body. Even body's enzymes are going to have effect over there. And one important thing, drug herb interaction will be over there because most of the drug in modern medicine, they are developed from the herb. Can you name any herb from which new modern medicine is developed? Do you remember? Do you remember, or shall I tell you? That like you can read afterward. Aspirin is there. Then many of the hypertensive drugs are there. Still today we use digitalis. Opioid analgesics are based for evolving of all barbiturates and other sedative hypnotics. So list is very big. So definitely these herbs are potent and they give effect. So one case is of Swarna Bhasma. Swarna Bhasma is very classic Ayurvedic preparation, and one lady residing of 35 years old residing somewhere in Nepal, she had a liver problem. She was having symptoms of jaundice. So it is always a thought process. Kavadi's aushad, jaundice can be treated with the help of herbs. So she had one powder, always the name was not given, so she was not aware what it is that. And within a week, she was taking that drug for entire week. And afterwards, what happened? She started losing her weight. Half of her weight loss was there. Suppose she was 50 kg, 25 kg as her weight has become. She was severely ill and having infection, very high fever. Then she was taken to ICU, entire monitoring was done, and it was found that the drug itself has shown toxicity to her liver. Though she was having jaundice, it was infectious jaundice, and infection was now was gone to advanced stage. Then she was given all the proper medication to treat her jaundice with the help of antibiotic. So it doesn't mean that Swarna Bhasma is of no use, but proper care should be there. This is just a simple negligence happen over there with a simple thought that if it is from herb or Ayurveda, there is no adverse drug reaction or adverse drugs, what we say reports are there. Another is Reserpine. The Reserpine is very well known antihypertensive, but it should not be taken without medical supervision or prescription. The man went to store and he just got something from herbal origin. I want to treat my disease on, and I will get something from herb origin to treat my hypertension. But for 2 years he was taking Reserpine based medicine without any proper medical supervision. Third case is of one lady who was having body pain, body ache, and again she had some powder from some quack. There is magical remedy act and other acts are there, you are going to learn. And she started gaining weight like anything. Then they did the research of that powder, what is over there, and in that analysis they found it is full of steroids. Then she was given proper treatment. You will find in all these 3 cases, the basic role of pharmacist is neglected. And hence, we are not only dispensing, we are comprehensive health service provider. And this is one of the important things all of you are going to keep in your mind. See, once these things are over, I am going to ask you your reflection that what you learn and what you are going to do in future. And that's why I will not say pay attention, be involved. Okay. Next to that is we should know the entire drug information. There are many sources for any drug information. You can't say like that while practicing that ye humko padhaya nahi gaya. There are, as principal sir said, that there are newer, better drugs, medicine, formulations are there from industry. You are going to keep yourself updated. You are having complete right to say no to certain prescription drug. You can actually tell the physician who is prescribing that, oh, this drug is now banned. This is showing these many side effects. Under the regulatory aspect, this portion of the this part of drug or this kind of drugs are not prescribed now. You should be aware of this drug information. Next to that is self-care preparation. I want to be fair within 3 days. Give me some medicine. I want to grow my hair. I want to remove my certain hair, or I want to be more beautiful, elegant eyes. You know, beautiful, elegant, wow, looking like wow, I want to be there. And within few seconds, those self-care products, whether they are having some serious effects, severe effects, adverse effect. Actually, we are doing study on this, adverse drug reaction related thing. We are the bridge between the patient and the current medicine system over there. So patient will come to you first. They could be your relatives, they could be somebody who is residing in your premises, they could be your dadi, nani, chachi, koi bhi hoga. They will come to you, are aisa hua hai. Now they are looking at you with a hope. I told, power ke saath responsibility bhi aati hai. So you have to behave much more with responsibility, that whether this kind of self-care products, self-awareness, self-care products, whether they are really useful, if they are showing some adverse reactions, you have to know the entire scenario, how to report those reactions. Next to that is clinical pharmacy practice, that how that clinical pharmacist should work, you are going to learn. And then distribution practice. Now here I want to add one more case study. And then I will just have 2-3 things and then I'll stop, and then I'm going to ask you questions. Not question, reflection. So, distribution. Anything is to be distributed always with ethics. So, even for the medicine or the preparation, long back, codeine phosphate case happened many places in Maharashtra, and now codeine phosphate is not at all available as such in the store, pharmacy store, or the chemist shop. The codeine phosphate distribution is always under the watch by government. This is very good drug. In case of what we say cough, it is anti cough suppressant, antitussive preparation, but it is having its root with morphine. It is analog of morphine and found naturally, also can be prepared semi-synthetic way. It causes it is now proven as drug of abuse. There, people used to take many bottles as a drug of abuse under the name antitussive drugs. Even I have seen some mothers, they were taking this drug for their kids क्योंकि वो बहुत मस्ती करता है, उसको सुला देना है. This drug is having very long, severe adverse drug reaction. It directly work on brain. So when these things were reported, the ethical distribution responsibility were questioned. That as a pharmacist, you have to keep the record if such kind of drug, who is purchasing, for what reason, and so on. And then there was awareness, and same thing, last thing I told, that mother was getting those bottles for her kids. That pharmacist scolded her. I was standing next to him and scolded her that this is not the drug of khasi. This is acting on your brain. You are actually paralyzing brain capability, thinking capability of your kids. Then what she said, आपने नहीं दिया तो दूसरी जगह पे मिलेगा. Here is the question for your responsibilities, especially ethical responsibility. The drugs or the chemicals or whatever you are using, they are very potent. They are xenobiotics. If you love sugarcane juice, खाने की जगह पे sugarcane juice पीता है क्या कोई? We have food. Sugarcane juice is just supportive thing. Same is in case of medicine. They should not be overused, over-prescribed, over-distributed as. So what is it? Then next to that is RUD, rational use of drug. Very important thing has to be remembered. How much is the need and how much is the dose required? For how much time, how much period this drug has to be taken? And very important thing, cost-effective therapy. It should not be burden on family. One more case. One lady was there. She was not well and they were very poor, simple people. She got the prescription. Her husband went to go get those entire medicine, and then they found that it's a antibiotic, a kind of nutritional supplement. Because of antibiotic, lactobacillus and other things were there, and few antacid and other tablets where the entire prescription was having 5-6 tablets. He is not educated, he has to pay the bills. Then he started thinking, इसमें से जो महंगा है ना वो निकाल दो. And the antibiotics were most expensive. And he was thinking from his pocket कि मेरा pocket में कितना burden आएगा. So antibiotics निकाल दिया, that ill lady will not get recovered. Baki ka is the supportive thing that is also necessary. Then he told that pharmacist who was behind the table should know the psychology of people. You just can't study the things and I'm done. He actually properly counseled that husband that all these things are necessary. There are generic things are available. And if you can't afford that also, in government hospital, very cheap medicines are available. But don't remove the antibiotic from your prescription. All these things are important. He took 10 minutes to make that person counseling. Tala patavun dila, yes, this is necessary. Such kind of role is necessary over there. And one important thing, you're going to build your image in the community. Whatever you are going to do is going to have your own impact in the community. You are not only dealing with medicine, you are dealing with human being. So code of ethics of pharmacist is very important. I wish you I can see your very good fortunate future in the coming era, and you are going to be a very good pharmacist and very good human being. So I'll just stop now, and I just want, if you can write on your own, you can have your reflection, what you're going to promise yourself on this great day. You can read about Mahadev Lal Shroff. He was the first person who had gone beyond whatever the era. You can see in the previous, when we are not at all independent, he had got vision that I will have the pharmacy education and my entire India will get quality medicine. For that, I have to start from very basic with the education. Once people are educated, then only quality medicines will be over there. So you can think from that point of view. All the best. Thank you. Actually, forward in WhatsApp, the real WhatsApp message. It was actually reported in one very good journal by my guide, Dr. Pratima Tatke, our principal. This was very something which you have to think of. Please pay attention. This is something can change your life also. The lead-based products are very common in the Ayurvedic preparation. And over here, I told you that how much is the need of that drug, how much is the cost, and very important thing, dose, and how much period that drug has to be taken. Always there is period, that 5 days, 10 days, 15 days. This is very important part of prescription. मुझे अच्छा लग रहा है तो लाइफ लॉन्ग खाना है, ऐसा नहीं है. Always, and as a pharmacist, you are not supposed to sell this. इस पूरा साल भर खा रहे हो, जाके उसका dose, definitely it is going to change. If the dose, if it is not changing, then something is wrong. That person is not visiting the physician or that whomsoever is having that authority to write the prescription. One person came to ICU and he was almost fainted, almost coma-like condition was there, and he was hospitalized. And in the hospital, he was not at all responding to any treatment. The neurophysician over there who started monitoring that patient, and definitely as per routine they have taken that all these brain images and all those things were done. Then they found that his brain is having some chelation, something over there, because if that images of brain are there are gray and white matter is over there, so entire thing is looking gray, something is over there. Then he tested, they found that there was a lead deposition in his brain. They started finding out that that person was having lead poisoning. Lead poisoning is very rare case, and how it has happened. So they started screening his diet, water, what could be the source from which lead poisoning can happen. They started interrogating his wife that what he is having. So she was very much reluctant. Finally, she told that I am giving him his Ayurvedic preparation my friend has suggested. And whatever was there, a paper, I got a very fresh paper. It was torn paper, एकदम old paper. घडी करून पर्स मध्ये ठेवलेला असतो ना तसा paper. That was a rasa sindoor preparation. Rasa means the mercury. And sindoor means lead, that is not lead, lead oxide, ज्याला आपण शेंदूर म्हणतो मराठीत. So it was mercury lead oxide preparation, and her friend suggested for diabetes, and she was giving that medicine for almost 3-5 years to her husband. She was unknowingly poisoning her husband with lead. He took that rasa sindoor, and it was very old case. Entire thing was analyzed. Lead content was to be found out in India. Not every lab was having that services. So he was basically from Mumbai. He has given that physician, that neuroscientist whomsoever was there, he has given those medicine, that bottles to Bangalore. Some lab was there, over their analysis. The Bangalore lab person was his friend, and immediately he tested and he told, who is having such kind of thing? This is mere poison. It is having very high amount of lead. Now, in Mumbai, there are many labs who can do this analysis of lead, but without knowing that whether it is necessary, how much is the dose, and how much period that rasa sindoor is to be taken. Unknowingly, that lady was poisoning her husband, and from where she was procuring rasa sindoor? Nowhere, only from pharmacy store. If she would have interrogated at very first time that why you are taking something like this, afterward this trauma would not have happened. And then he treated with EDTA. You know EDTA form chelate with lead. You have done the experiment also. So EDTA treatment was given and that patient was fully recovered. It was no infection. It was just lead poisoning. But it was life-threatening. So such kind of cases may appear in your life. You be vigilant, keep your eyes open, keep your ears open, keep your brain open. You can save someone's life. Thanks.
Okay, so thank you so much, ma'am, for your such wonderful examples. You have taught us lots of things today. As we all know, ma'am told us about responsibilities of pharmacists by ethical way and information about lots of drugs developed from herbs, and now I'm going to remember that aspirin is one of the example of that. Now, adverse effects of drugs by giving an example of that woman, as you told, then importance of correct or administration of drugs should be done by pharmacists. This is one of the important responsibility of pharmacists. And you also told us lots of things by giving such a wonderful example. So thank you for that. I stand here today as a proud and grateful student to express my heartfelt thanks to all of those who have made this event possible. I would like to start by thanking our college management who have always been supportive to our initiative and encouraged us strive for excellence. I would like to express my appreciation to our guest, Dr. Rohini Bagmare ma'am, who has taken time out of their busy schedule to grace this occasion with this presence. Your presence has added an extra spark to this event and made it more special. I would also like to extend my gratitude to the principal, Sir Dinesh Girab sir, and the head of the department, Mrs. Vanita Saharan ma'am, and all the teachers and supporting staff who have been our guiding lights, imparting wisdom and knowledge to us and nurturing our talents. Their unwavering support has been instrumental in our growth and development. Finally, I would like to thank each and every one of you, my classmates and friends, for your support and participation in making this event a grand success. In conclusion, I would like to say that this event would not have been possible without the support of hard work and of each of you, everyone. On behalf of our department, I would like to express my sincerest thanks to all of you. Thank you all. And now I request everyone to rise up for the national anthem.
पंजाब सिंध गुजरात मराठा द्राविड़ उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्छल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मागे गाहे तव जय गाथा जन गण मंगल दायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे।
Thank you so much to all of you. Have a good day.